The kidneys play a vital role in maintaining overall health by filtering waste products and excess fluids from the blood. However, some daily habits can put undue stress on these vital organs, leading to kidney damage over time. In this video, we will examine 10 bad daily habits that have the potential to damage your kidneys and discuss ways to reduce these risks. 1. Insufficient hydration. Insufficient hydration can seriously damage your kidneys. Think of your kidneys as meticulous filters that work tirelessly to clean your blood and maintain fluid balance. Without enough water, this filtering process is strained, making it harder for the kidneys to remove waste effectively. Over time, this strain can lead to the painful formation of kidney stones. Dehydration also creates a breeding ground for bacteria in the urinary tract, increasing the risk of urinary tract infections, UTIs. If left untreated, these infections can progress to the kidneys, causing irreversible damage. Proper hydration acts as a shield against toxic concentration in the bloodstream. Without it, toxins become more concentrated and contribute to the development of chronic kidney disease. The increased concentration of minerals and salts in the urine due to dehydration can lead to kidney stone formation. These stones can block the urinary tract, causing not only discomfort but also the potential for kidney damage or infection. Preventing kidney damage starts with a simple solution: staying hydrated. The recommended daily water intake is about 3.7 liters, 125 ounces, for men and 2.7 liters, 91 ounces, for women, including all fluids and foods. 2. Excessive salt consumption. Excessive salt consumption can cause damage to your kidneys. Imagine your kidneys as diligent regulators that maintain the delicate balance in your body. When you load your system with too much salt, this balance is upset, setting off a chain of harmful effects. First, high salt intake can raise your blood pressure. The kidneys play a crucial role in regulating blood pressure by managing the balance of sodium and water. When you consume too much salt, your body retains water to dilute the excess sodium. This leads to an increase in blood volume and consequently higher blood pressure. Over time, sustained high blood pressure can damage the delicate blood vessels in the kidneys, reducing their ability to function properly. Moreover, increased pressure can contribute to the formation of kidney stones. High levels of salt in the urine can crystallize to form these painful stones that can block the urinary tract, causing discomfort and potential damage to the kidneys. In essence, excessive salt consumption poses a serious threat to kidney health. By being conscious of your salt intake and making an effort to reduce it, you can protect your kidneys from the harmful effects of long-term sodium overload. 3. Excessive caffeine consumption. Excessive caffeine consumption can potentially pose a risk to kidney health. While moderate caffeine intake is generally considered safe for most individuals, consuming large amounts over a long period of time can lead to a variety of adverse effects on the kidneys. Caffeine is a natural stimulant found in coffee, tea, energy drinks, and some medicines. Its diuretic properties can increase urine production and, if not accompanied by adequate water intake, can lead to dehydration. Dehydration puts additional stress on the kidneys, which need proper hydration to function optimally. The diuretic effect of caffeine can lead to the loss of essential minerals such as calcium, magnesium and potassium through the urine. This mineral imbalance can contribute to the formation of kidney stones, a condition in which crystal deposits develop in the kidneys, potentially causing pain and blocking the urinary tract. In addition, excessive caffeine intake has been linked to high blood pressure. High blood pressure is a major risk factor for kidney disease as it can impair the structure and function of blood vessels in the kidneys. Over time, this can lead to reduced kidney function and an increased risk of chronic kidney disease. 4. Ignoring urinary tract infections. ignoring urinary tract infections, UTIs, can be detrimental to kidney health. UTIs typically start in the lower urinary tract, but left untreated, bacteria can travel to the kidneys and cause a more serious infection called pyelonephritis. Over time, this can lead to chronic kidney infections, scarring and impaired kidney function. Renal scarring can contribute to chronic kidney disease, CKD, a progressive condition in which the kidneys lose their ability to function properly. Untreated UTIs can also cause complications such as abscess formation, cyst development and, in severe cases, sepsis, a life-threatening condition with systemic effects on various organs, including the kidneys. Chronic kidney infections can contribute to hypertension, creating a cycle of worsening kidney health and high blood pressure. Timely treatment of UTIs is crucial to prevent these complications and preserve kidney function. Symptoms such as pain when urinating, frequent urination or cloudy urine should prompt medical attention to prevent long-term kidney damage. 5. Overuse of painkillers. Overuse of painkillers can pose significant risks to kidney health. These medications, including nonsteroidal anti-inflammatory drugs, NSAIDs, and some analgesics, are commonly used to relieve pain and reduce inflammation. However, they can have harmful effects on the kidneys if taken excessively or for a long time. The kidneys play a very important role in filtering the blood, removing waste products and regulating fluid balance. Overuse of painkillers, especially NSAIDs such as ibuprofen and naproxen, can interfere with this complex filtering process. Long-term or high-dose use of these drugs can lead to reduced blood flow to the kidneys, which can cause acute kidney injury, AKI, or worsen pre-existing kidney conditions. NSAIDs work by inhibiting enzymes involved in inflammation, but they also affect the production of substances that help regulate blood flow in the kidneys. This dual effect can cause the blood vessels to the kidneys to narrow, potentially causing ischemia, lack of blood flow, and subsequent kidney damage. In addition to disrupting blood flow, NSAIDs can contribute to the development of kidney problems by causing sodium and water retention. This can lead to an increase in blood pressure, further straining the delicate blood vessels in the kidneys. It is very important that individuals use painkillers responsibly and under the guidance of a healthcare professional. Those with pre-existing kidney disease, hypertension or other risk factors should be especially careful. Alternative pain management strategies such as physical therapy, lifestyle changes or non-pharmacological interventions can be considered to minimize dependence on painkillers and reduce the risk of kidney damage. 6. High-protein diet. Consuming a high-protein diet can pose a risk to kidney health. The kidneys, which are responsible for filtering waste from the blood, may have difficulties processing excess protein. High protein intake increases the production of nitrogenous waste products, forcing the kidneys to work harder. This strain can contribute to kidney damage over time. Elevated levels of calcium and oxalate in urine due to animal protein consumption can lead to kidney stone formation. Long-term adherence to a high-protein diet is linked to a decrease in glomerular filtration rate, GFR, indicating potential kidney dysfunction and an increased risk of chronic kidney disease, CKD. The association between a high-protein diet and risk of CKD suggests caution is warranted. Furthermore, such diets can contribute to dehydration, concentrate urine and promote the development of kidney stones. Individual responses to high protein intake may vary, taking into account factors such as general health and pre-existing kidney conditions. To minimize harm, individuals considering a high-protein diet should seek guidance from health professionals or dietitians. Balancing protein sources, including plant-based options, and ensuring adequate hydration are key practices to support overall health while maintaining kidney function. 7. Ignoring high blood pressure. Ignoring high blood pressure can have serious consequences for kidney health. The kidneys play a crucial role in regulating blood pressure by managing sodium and water balance. When blood pressure remains consistently high, over time it can damage the delicate blood vessels in the kidneys. Persistent high blood pressure, also known as hypertension, can lead to chronic kidney disease, CKD. Increased pressure puts pressure on the kidneys, impairing their ability to efficiently filter blood and maintain proper fluid and electrolyte balance. This can lead to a gradual decline in kidney function. What's more, hypertension can damage the nephrons, the tiny filtering units inside the kidneys. The constant pressure on the blood vessels can cause them to narrow and weaken, reducing blood flow to the kidneys. This reduced blood flow can lead to further kidney damage and contribute to the development of conditions such as proteinuria, excess protein in the urine, and albuminuria, the presence of protein albumin in the urine, which are indicators of kidney dysfunction. 8. Excessive alcohol consumption. Excessive alcohol consumption poses serious risks to kidney health. The kidneys, which are responsible for filtering waste and fluids from the blood, can be adversely affected by the toxic effects of alcohol. Chronic alcohol intake can lead to dehydration, disrupting fluid balance and preventing waste filtration. Alcohol-induced electrolyte imbalances further compromise kidney function. Alcohol-induced hypertension strains the renal blood vessels, potentially causing long-term damage. Excessive alcohol consumption increases the risk of acute kidney injury, causing sudden drops in kidney function. Alcoholic nephropathy, a condition resulting from chronic alcohol use, causes kidney inflammation and scarring, impairing filtration and fluid regulation. Chronic alcohol use increases the risk of developing chronic kidney disease, a progressive condition that can lead to kidney failure. Alcohol can also interact with medications that are crucial for kidney management. Moderation in alcohol consumption is vital to protect kidney health. Seeking medical help for alcohol dependence or kidney concerns is very important. Lifestyle adjustments, including a balanced diet, hydration, and blood pressure management, are key to maintaining kidney function and overall health. 9. Smoking. Smoking significantly damages kidney health through several mechanisms. The vasoconstrictive nature of cigarettes reduces blood flow to the kidneys, impairing the kidney's ability to effectively filter waste. Furthermore, smokers face a high risk of kidney cancer. The toxic components of tobacco smoke contribute to the development of renal cell carcinoma. For individuals with pre-existing kidney disease, smoking can accelerate the progression of the disease. The synergy between smoking-induced hypertension and its independent effect on kidney function further increases the risk of kidney damage. Smoking has also been associated with an increased likelihood of kidney stone formation by inhibiting urinary tract function. Quitting smoking is crucial for maintaining kidney health. The benefits of quitting smoking go beyond respiratory health, positively affecting overall organ function. Getting support through smoking cessation programs, medications, or counseling increases the chances of successfully quitting smoking and reducing the risks associated with smoking-related kidney damage. 10. Lack of exercise. A sedentary lifestyle characterized by a lack of regular exercise can affect kidney health in several ways. Inadequate physical activity can lead to reduced blood flow to the kidneys, potentially affecting their optimal function. Lack of exercise is also associated with an increased risk of hypertension, a major contributor to chronic kidney disease, CKD. In addition, inactivity is linked to insulin resistance and an increased risk of developing type 2 diabetes, a major risk factor for kidney disease. Lack of exercise contributes to weight gain and obesity, both of which are associated with a high risk of kidney problems. Obesity is often linked to metabolic syndrome, which includes conditions such as high blood pressure and abnormal cholesterol levels, further damaging kidney function. Regular exercise has anti-inflammatory effects, while inactivity can contribute to chronic inflammation, which is known to be detrimental to kidney health. Physical activity also helps regulate fluid balance in the body, preventing complications such as fluid retention and swelling. Protecting your kidneys involves making conscious choices in your daily habits. By staying hydrated, eating a balanced diet and adopting a healthy lifestyle, you can reduce the risk of kidney damage and support overall health. If you have concerns about your kidney health, it is essential to consult a health professional for personalized advice and guidance. Thank you for following me. Don't forget to like the video and subscribe to my channel to learn more about these topics.